Hello everyone, welcome to SV Union High School and Junior College. And all my dear 5th standard students are welcome back to my YouTube channel. Students, we are going to study the new lesson number 23, Infectious Diseases and how to prevent them, from page number 121. In this lesson, they have asked us the question that when your friends fall while playing and get hurt, does anyone tell you, don't go near them, you will also get hurt? In question number 2, they have asked the question, suppose your mother has a headache. Do you also get a headache if you go near her? When is it that you are told not to go near a sick person, not to use their utensils for eating or drinking, not to use their hankies, towels, or clothes? So, students, let's find out these questions' answer. In the first question, if you see anyone is getting hurt while playing, no one tells us like that because we will not get hurt because the friend is hurt. The second question's answer will be that no, I will not get a headache if I go near to my mother. While in the third question, we are not told not to go near a sick person when the person is suffering from cold, flu, is having high fever, or if the person is suffering from chickenpox, measles, mumps, etc. Now students, let's start with infectious diseases. Mother's burns or grandpa's backache are not passed on from them to others. However, one has to take care to stay away from people who are ill with flu, that is influenza, cold, ringworm, scabies, chickenpox. These diseases spread from one person to the other. Such diseases are called infectious diseases. We will learn them in detail in this part. Infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, or parasites. But under certain conditions, some organisms may cause diseases. Some infectious diseases can be passed from person to person. Now students, we are going to understand what causes these diseases. They are caused by microorganisms. Every infectious disease is caused by a specific microorganisms or germ. When the germs of a particular disease enter the body and begin to grow, the person gets the disease. So students, let's try and understand what is the meaning of disease. A disease is an abnormal condition affecting a living organisms. Which of the following is caused by a microorganism diseases such as common cold, tuberculosis, measles, chickenpox, polio, cholera, typhoid, hepatitis B, malaria are some common human diseases caused by microorganisms. Students, do you know the meaning microorganisms mean? A microorganism is a living thing that is too small to be seen with the naked eye. Students, let's see the next question, that is, how is one person's diseases passed on to another person? When a person has cold, the germs from his body spread in the air. When he coughs or sneezes, when these germs enter other people's body, they can also get the disease. That is, the disease spreads. Typhoid spreads when its germs are passed on by a person ill with typhoid to another person. Students, I would like to give you some information about cold and flu. What is the difference between them? Cold. Colds are usually milder than flu. People with colds are more likely to have a runny or stuffy nose. Colds generally do not result in serious health problems such as pneumonia, bacterial infection, but flu can have a very serious associated complications. The symptoms of flu can include fever, or we can say feverish, cough, sore throat, runny or stuffy nose, muscle or body ache, headache, fatigue, that is tiredness. Cold symptoms are usually milder than the symptoms of flu. Germs can spread to the hands by sneezing, coughing, or rubbing the eyes, then that can be transferred to the other family members or friends. Typhoid fever is an infection that spreads through contaminated water and food. Typhoid is a bacterial infection that can lead to a high fever, diarrhea, and vomiting. It is more prevalent in places where hand washing is less frequent. It can also be passed on carriers who do not know they carry the bacteria. How long does typhoid stay in our body? It depends on how many bacteria you have swallowed. It is usually between 7 to 14 days, but can be as short as 3 days or as long as 30 days. Symptoms vary from mild to severe and life-threatening. So what should not be eaten in typhoid? Foods that are high in fiber should be limited on the typhoid diet to help ease digestion. This includes raw fruits and vegetables, whole grains, nuts, seeds, spicy foods, and foods that are high in fat may also be difficult to digest and should be limited on the typhoid diet. We know that polluted water, food causes typhoid fever. Improper waste disposal and dumping sewage into water sources, unclean public water supply, water pipes that allow bacteria to seep into the water, typhoid infected people handling the food or water that you consume, fruits or vegetables that grow on land that has been fertilized and with untreated sewage, cooking food and utensils washed with polluted water. When flies sit on your food, you know which organ is affected by typhoid? Yes, typhoid is a bacterial infection. It does not just affect one organ but multiple organs of the body. After reaching the bloodstream, the bacteria attack the gastrointestinal tract, including the liver, the spleen, and muscles. These are called as infectious diseases. What are the different ways in which infectious diseases spread? Infectious diseases can spread in a variety of ways: through the air, from direct contact with another person, soiled objects, saliva, urine, blood, and through contaminated food and water. So let's start with the first part: spread of diseases through air. The germs of a disease like influenza are present in the spit or saliva of the person who has the disease. When he coughs or spits, they enter the air with the tiny droplets of saliva or spit. When another people breathe in that same air, the germs enter their bodies. Diseases of the throat and the chest spread through the air. For example, a cold and cough, tuberculosis, swine flu, etc. That is why we are told to cover our nose and mouth when we cough or sneeze. Can germs spread through the air? Germs can be spread in the air. Droplets containing germs are released into air when a person coughs or sneezes. These tiny droplets can travel as far as 6 feet and can spread germs by landing on surfaces or in other person's eyes, nose, or mouth. Can you get sick from breathing same air? Simply standing back when someone coughs or sneezes won't necessarily protect you from the flu. You also need to keep your distance when a sick person breathes. That's because the virus can be spread just by breathing. Is flu airborne or droplet? The flu is primarily spread through the droplets released when an infected person sneezes, coughs, or speaks. These droplets land in the mouth or noses of people nearby. Or less commonly, a person might touch a surface contaminated with them, then touching his or her own face. That means airborne diseases can spread when people with certain infectious cough, sneeze, or talk. Some viruses or bacteria flight and hang in the air or land on another people or surfaces. When you breathe in air, they take up in you. How long do flu droplets stay in the air? Flu viruses can survive as droplets in the air for hours and on surfaces for up to a day, but can only survive for 15 minutes. Use tissues to cover your mouth and nose when you cough or sneeze. Now students, let's understand the symptoms of cough. The most common cause of a cough is a respiratory tract infection such as cold or flu. Respiratory tract infections are usually caused by a virus and may last from a few days to a week. Infections caused by the flu may take a little longer to clear up and can sometimes require antibiotics. Coughs come about for different reasons and each may sound or feel different. There are two main types of cough, from a cold or flu, wet cough and dry cough. Do you know a wet cough might be more noticeable at night when you lie down since the change in position can, while a dry cough can also disrupt sleep. How do TB or tuberculosis symptoms start? The signs and symptoms of TB include coughing that lasts 3 or more weeks, coughing up blood, chest pain or pain with breathing or coughing. Can TB be cured? It can almost always be treated and cured with medicine. If you have TB disease, you will need to take several different medicines. This is because there are many bacteria to be killed. What happens to a person who is affected with TB? He has pain in the chest. Sometimes he might be also having a pain while breathing. His whole body becomes fatigue, fever, loss of appetite, night sweat or sweating. The most commonly thing what is observed in tuberculosis is loss of muscle, severe unintentional weight loss, shortness of breath or swollen lymph nodes. Now we are going to study the next part, that is called as swine flu. Swine flu is more likely to include diarrhea and vomiting, as well as the respiratory system that comes with typical seasonal human flu. We can also indicate swine flu as H1 or N1 virus infects deeper into the lungs than any common flu. Like the regular flu, swine flu can lead to more serious problems including pneumonia, a lung infection and other breathing problems. And it can make an illness like diabetes or asthma worse. If you have symptoms like shortness of breath, severe vomiting, pain in your belly or sides, dizziness or confusion, go and visit to the doctor. Precautions to be taken when you see a person who is affected with swine flu. Wash your hands throughout the day with soap and water. Don't touch your eyes, nose or mouth and avoid people who are sick. Students, we have completed with page number 121 part 1. I hope so. You must have understood what are infectious diseases, the spread of infectious diseases and spread of diseases through air. In the next part, we will be continuing from page number 122 onwards. Till then, stay safe, stay healthy. Thank you.